In 2011, Jessica Sparks was on top of the world. She was a registered nurse, earning a practitioner's degree at UAB, and had just made a life-changing decision to move to Huntsville to be closer to her boyfriend, Will. That's when she noticed a lump on her breast.
This was a new step for us in our relationship, and then all of a sudden to have this huge, anvil dropped on our heads, it was just, you feel like all of a sudden you've got to make a ton of decisions that possibly may alter the course of the rest of your life, and you've got to make them so fast.
Jessica was diagnosed with breast cancer and turned to the UAB Comprehensive Cancer Center to discuss treatment options. The team recommended radiation and chemotherapy and surgery, but Jessica had another concern. Would she ever be able to have children?
In her mind, that was one of the most important issues, more than thinking about chemotherapy. Am I going to lose my hair? Do I have to stop working? One of her main issues was, I want to be a mother. I really want to have children. And if I'm going to be receiving chemotherapy, I may jeopardize that.
The cancer team referred Jessica to UAB fertility specialist Wright Bates. He recommended an in vitro fertilization cycle where Jessica would be given medications to stimulate her ovaries. Her eggs were harvested and then frozen, giving her options after her cancer treatment.
Egg freezing is more difficult for a variety of reasons than embryo freezing. Her case actually involved both, which is the unusual component.
3 years later, newly married and with the cancer treatment successfully behind them, Jessica and Will decided to have a baby. In September of 2014, the fertility team planned an embryo transfer by thawing Jessica's eggs and fertilizing them with Will's sperm. But there was a small setback. Jessica's body didn't meet certain receptivity markers required for transfer, so they tried again in November.
Her uterus responded beautifully. Things were good to go, so the embryos were thawed after being frozen, and she had a transfer and a beautiful end result, I might add.
On July 28, 2015, almost 4 years later,
He's awake.
Jessica and Will welcomed William Cooper Sparks into the world, the healthy 10-pound, 4-ounce baby boy they call their miracle.
It was so surreal. Even taking all of the cancer and fertility stuff out of the equation, it was amazing. And it took a couple weeks to sink in, but now he's a great baby. He's a really good baby and very calm, and we're just overjoyed to have him.
That joy is shared by the UAB team that cared for them and helped them navigate a long, scary, and difficult road.
I always tell my patients that my breast cancer patients are my heroes, The most rewarding part, being a mother and help to go through the process and the anxiety, do I have to stop my medication for breast cancer? Will this affect my chances of surviving the future? And then achieving those goals and then see her pregnant, walking through the halls in the clinic and then having a wonderful, lovely baby is rewarding, it's amazing. It touched the heart of anybody.
It's especially satisfying for me and my team to now see the end results of our efforts, and makes us even more committed to fertility preservation, and even more thankful that we are part of a great institution like UAB that's really at the forefront of technology, of treating the whole person, not just treating their cancer.